your mute button. And we will mute everyone here in just a few minutes, but if you could help us out and push your mute button to begin with, that would be great. Oliver, go ahead and take it away.
Sounds good, Alan. Thank you very much. Good afternoon, everyone, and thank you all for joining us for today's webinar. Another reminder, if you've just joined us, please mute your phones during the webinar, and we appreciate that very much. As Alan mentioned, my name is Oliver Yandel, and I'm the Executive Director of the Association of Legal Administrators, and we're really excited to share this new benefit offering with you today. As you know, ALA is always looking for opportunities to provide you and your firms with valuable benefit programs that offer protection, efficiency, and cost savings through our Value and Partnership program. And a key player in developing these programs has been GLJ Benefit Consultants. They've done a tremendous job, as many of you know, in identifying, sourcing, and vetting a wide range of unique and exclusive benefit programs for our members and their firms. And here today to tell us about a very exciting and free healthcare benefit is our good friend, National Program Director for GLJ Benefit Consultants, Alan Wilson. Back to you, Alan.
Thank you. Thank you so much, Oliver. And thank you to everyone who has joined the conference. So here I go one more time. If you've just joined us, go ahead and push your mute button. I'm afraid that everyone's going to remember me for that from now on. Wow, look at that. There's just more. They're just pounding in on this. Thank you so much for joining us. Go ahead and press your mute button. And I am Alan Wilson from GLJ Benefit Consultants. We're so very, very happy that you're able to join us. We have a huge crowd here today. There's just a tremendous amount of buzz. There's a tremendous amount of buzz on this particular program. What this program is, and we've been working on this for months with the group, with the corporate group there at ALA. Really, we'd like to introduce SingleCare to you today. SingleCare is a price-transparent marketplace for self-pay healthcare for your whole workforce. This is a benefit that you'll be able to take advantage of as a member, certainly, but it's also a benefit that you will be able to take to your firms and that you will be able to activate within your firms. This is a free benefit. There is no cost to having this benefit. We're going to go ahead and introduce it to you, but we want to make it absolutely clear that there is no cost to have this card and to have this benefit available to you. This is not an insurance program. This is, go ahead and hit your mute button if you've just joined. This is not an insurance. This is not insurance. It does not take place of your insurance. It works alongside and can help, but this fills gaps. This is once you see this, I think you're going to be amazed. What this does is this is a consumer healthcare product. This gives you the ability as a member, as you activate your card, this gives you the ability to have discounted rates for medical services and for prescriptions. Go ahead and hit your mute button if you just joined. We're going to show you how this works. I know that you're saying, well, how could this not cost me anything? How could this not be? As we show this to you, I think that you're going to understand very, very clearly, and this is going to come in very, very clearly to you on how this will work and help not only you, but your families and also your employees and your members of your firm. So I'm going to go ahead and turn the time over to David Sleepak from SingleCare, and he's going to go through everything with you. So thank you so much, and thanks for joining us today. And we will have questions available that you'll be able to ask after the session is over, and David will tell you a little bit more about that. So thanks for joining us today, and I hope everyone's having a wonderful day. David?
Alan, thank you very much. Oliver, appreciate your introductions as well. I'm David Sleepak, and I'm the Director of Field Sales and Marketing here at SingleCare. I'm actually sitting here in Phoenix, Arizona, but actually our corporate headquarters are located in Columbus, Ohio. So as Alan mentioned, we're going to go through a little bit about SingleCare today, the benefits and services that we offer, and the value that we'll be able to bring to you and your families with healthcare. So during the call, again, Alan stressed to mute your button. That's great. And then we'll definitely have some contact information on the final slide, so you're able to ask questions and whatnot one-on-one. We'd be happy to answer any of those for you at the end of the session today. So we'll get going here. I know everyone's time is super valuable. So SingleCare is revolutionizing the way consumers access healthcare by creating a transparent retail marketplace for the direct purchase of healthcare services. And we'll give you a little frame up of kind of how we came to be. We're really stressing the ability to reduce your healthcare costs, and specifically in the pharmacy range as well. So this slide here kind of illustrates how healthcare spending continues to exceed GDP growth, and eventually it's going to be, account for a much larger share of GDP as time continues to go on. So everyone can feel the pain as our healthcare costs continue to rise. The next piece here is, again, this actually comes from the Kaiser Foundation. The cost of healthcare is a growing burden on families. And ultimately, we show kind of the employer expense, the employee expense, as well as the percentage of healthcare as it relates to overall income. So the one on the right actually shows median income in this country of about $52,000, and as of 2013, healthcare costs were approaching 31%. It looks like we're having a little challenge with hearing. We'll make some adjustments here so we can make sure everyone can hear the audio portion of this. The next piece here, and this is how insurance companies are able to kind of control the cost. One, they can reduce or narrow your network. So you just have limited doctors to see. And we get feedback all the time from our members saying, hey, my doctor was on my plan last year and they've magically disappeared this year. So again, those are ways to control costs from an insurance perspective. The other thing that we see quite often, which is a great opportunity for SingleCare to be put into use, is what's called closed formularies. So again, we get feedback from our members all the time. Hey, the prescription that I've been on for the last 20 years, it's no longer covered by my insurance, or it went into a different tier, and ultimately now it's more expensive. So these are two great examples of kind of how things are becoming more narrow, and how SingleCare will give you a little bit more options and some transparency in pricing, so you can help control those costs. So our value proposition is really simple.
David, if you've gone ahead and joined, go ahead and hit your mute buttons. Thank you.
We definitely have a packed house today. So again, the SingleCare value proposition is really clear, and as Alan mentioned, it is a free membership. So to be a SingleCare member, to be able to access our technology and our tools is completely free. So with that, we give affordability with managed care pricing. So we've gone out and pre-negotiated discounted services across the board. We offer access to a comprehensive suite of healthcare services. There's no administrative burden that takes place. And we are huge believers in pricing transparency. So you wouldn't go to the gas station and not understand what you're going to pay for a gallon of gas. You wouldn't go buy a car and just walk out the door and say, send me a bill. Although healthcare is very strange, we find that people go to the doctor or buy prescriptions and they're not quite sure what it's going to cost. So everything we do at SingleCare is clearly marked with a price, and that's super important in how we go to market. So SingleCare is really simple. You create an account, you search for a provider, you can compare pricing, and of course you can view your history. You do store a method of payment on our system when using some of our medical and dental services. That method of payment is similar to Uber or Amazon, and you can place an HSA card, an FSA card, a debit card. We've integrated with PayPal, and we just launched a PayPal credit option, which is very exciting. So if you're looking to finance maybe an elective type of procedure, you're able to finance as well. So after members visit a provider, SingleCare processes the billed amount on their card and pays the provider the negotiated rate. So again, it's a cashless transaction. We provide pricing transparency, low retail rates for members, and guaranteed payment. So let's quickly talk about our integrated user experience in online and mobile. There's lots of different ways to use our product and access our technology. For those that have smartphones, we have an Android and iOS app. For those that prefer a computer or a PC, with a beautiful interactive website that I'm going to show you here shortly. For those that prefer to access and talk to a live person, we have a U.S.-based call center in Columbus, Ohio that is bilingual. So you're able to call and get true concierge level services on finding a provider or looking up the lowest price for a prescription drug. So those are all great pieces of the program. Again, for our employers, simple implementation, and Alan will be able to help you with that. There's no administration. It's basically free rollout. And then it's a non-insured healthcare benefit for all of the members of your group or association. So if we give a quick overview of our products, and we have what we call our national product offering. Right now, today, in all 50 states, you're able to access our pharmacy product and pharmacy tool. We've partnered directly with the top 5 pharmacies in the nation with over 50,000 locations. Those include Walmart, Walgreens, CVS, Target, Rite Aid, and Kroger. We have a dental product that will be coming online shortly, and that will have a very comprehensive provider network for discounted medical services. We have a telehealth offering that's pay-as-you-go, which is somewhat unique. We have a vision product that will launch here shortly as well with Walmart. They are a strategic partner of ours. We'll be offering SingleCare members a $65 eye exam, as well as 5% off frames and lenses, and that's off their already discounted price. We're extremely proud and excited about the opportunity with Walmart. And then in early Q4, we'll be launching a hearing aid benefit that will give our members a flat fee for a hearing test, and then significant discounts off of retail price for hearing aids. In addition, available right now in the following states: Arizona, Pennsylvania, Virginia, Maryland, and D.C. We have dental, we have medical, we have imaging, physical therapy, and chiropractic services available in those states. So if you do reside in those states, and I'll give a quick demonstration of what that would look like, you're able to access those services today, right now, and other services obviously will be coming to a location near you. So if you bear with me here, I'm going to switch screens, and I'm going to share with you my web browser. I hope everyone can see the screen I'm sharing with you at the moment. So this is SingleCare.com, and as you receive your cards and log in, you're able to log into a dashboard, and your dashboard will look something like my demo dashboard here. With your member number, your name, you're able to create a medical team. We have our doctor on call, which is our telemedicine offering. You're able to look at your visit history on where you've been, and ultimately enter in promotions and credits. For all of our ALA members, we've offered a $20 credit into your account that is able to be used on dental or medical services in your area or elsewhere. And when you go to enter that promotional code in, you would add that ALA 20 right there and hit submit, and you'll pop a credit right into your account. So one of the most exciting pieces and where we really shine on a national level today is in our pharmacy program, which is really exciting. And we are able to provide to you complete transparency and pricing on all FDA-approved prescription drugs. So I often like to use, very commonly used, a drug called metformin. And ultimately, if you enter in your zip code right here and hit search, you're able to look and see, using SingleCare, the lowest price for prescription drugs at a pharmacy near you. We always will default to a generic if it's available. So the brand name here is glucophage, and the generic is metformin. You can also adjust dosage, quantity. If there are other forms available other than a tablet, you can pick those. If you notice, here on the right-hand side, we've listed all of the pricing at the associated pharmacies. This is for the exact same drug across the board. And when I show people this, they often gasp in disbelief to say, how could there be such a huge difference? One of the other things that we promote and show our members is where the $4 and $10 programs reside for all sorts of prescription drugs out there. And these are promotional type pricing that pharmacies offer. And incidentally, on metformin, Fry's, which is Kroger, and Walmart have these drugs on your $4 list. As you see, CVS, this actually is a Target, and then Walgreens, they're significantly more expensive for the same drug on this particular location. When you have a copay type of plan, you might have a $20 or $30 copay on your insurance. Ask what the best price is and show your SingleCare card. Obviously, you don't want to pay $20 copays for a drug that you could buy for $4. Conversely, if you have a $20 copay on your insurance and it pops up on here that the lowest price is $86, then certainly pay the $20 copay. So that's our pharmacy finder. Again, this is available instantly today at over 50,000 pharmacies across the U.S. Also going to demo for you our website on finding a dentist. And if you notice here, our website is very intuitive. So you can actually search for reason for a visit, like I need a dental cleaning or I have a cold. You can search by specialty, so a particular specialty. You can search by a provider, so hey, my friend sees Dr. So-and-so, I'd like to see him or her. You can search by practice. Hey, I was driving by and I saw Rocky Mountain Dentistry, or obviously the prescription. So at this moment, I'm just going to pick specialty. I'm not necessarily looking for a particular dentist, but I want one near me. And ultimately, I'm again in Arizona, and I've pulled up a dentist in these following locations. And in Arizona, we have about 120 pages of dentists that are able to see SingleCare members. So as I click in this particular dentist, it's going to show our location. I can add it to the medical team. Here's the phone number. And here's our live chat functionality. Again, we're really focused on the member experience and helping our members connect with a provider that is meaningful to them. So we're always going to have different options available to ask questions, and learn more about the products and services. So I said we're really big on transparency. So I'm going to see this particular person here, Fountains Family Dentistry, in this location. I'm going to say see pricing. And again, we'll show those prices for all of the different products and services. Cleaning, fluoride, x-rays. If you'd like to search for more, you can actually click more. And for those folks that want to take a deep dive in a particular procedure, you can search by name. You can actually search by CPT code. So I'm going to quickly go back to my dashboard here and answer a couple quick questions that always come up. Hey, I have kids. Can I put them in as well? For those folks that are under 18, we would love to have them be able to take advantage of the special pricing. So we can go to settings and ultimately enter in your dependents information for those that are under 18. And for those in the household that are over 18, it might be a spouse, a significant other, an adult child in the household that's over 18, they're actually eligible for their own account. And again, you'll want to make sure that you create one for them, and I'll show you how to do that as well. Go back to our dashboard here. So I'm going to switch back to our presentation mode here. Here's the backup plan if my internet connection doesn't work. The website is down, so we'll skip past the prescription finder. And here's a couple suggestions on when the best time is to use SingleCare. So on prescriptions, that is the easiest way to lower your costs in healthcare. Our statistics show internally that we're able to save the average American household about $300 a year annually on their prescription costs. This can be an extremely valuable tool for those practices or businesses that are in a self-funded plan or a partially self-funded plan, being able to spend those dollars wisely and kind of redirect some of those claims off of those. If you're on a deductible plan, again, sometimes your $20 or $30 deductible is significantly more, especially if that drug is on a $4 or $10 list. Those are great opportunities to save a few dollars in the pharmacy. Obviously, if one of your drugs has come off the formulary list, and we hear about this every day, especially around renewal time, certainly see what the price is with your insurance on the non-formulary. And again, check it with SingleCare. Dental coverage, if you don't have dental coverage, or sometimes if you do have dental insurance and you have a waiting period, oftentimes there's a 6 or 12-month waiting period for pretty invasive procedures. And then certainly anything cosmetic is also available at a discounted rate. And then, of course, our vision and hearing product will be great for additional discounts if you don't have those types of coverage. Again, I briefly mentioned our membership experience. Utilization for us is king, and being able to make sure that our members have a wonderful shopping experience online is really important. So there's lots of tools that you can access, including our call center. Again, based in Columbus, Ohio, it's bilingual, and they are able to walk you through all sorts of things regarding our website, tools, providers, prescriptions. Again, our paperless financial transactions, there's no confusing paperwork, there's no billing or those types of things. Pricing transparency, we have a lot of folks that have very generous and rich benefit plans, but they are an HSA plan, and they're responsible for the first $1,200 or $3,000, or I see some in up to $10,000 when you're on those types of plans. Even just using our technology to say, hey, I need an MRI or a CT scan, where it's going to be the lowest price in my area that might have one of those products. And although you use your insurance, which is great, you can certainly hone in on the lowest price place. We do send out email reminders to our members to promote wellness, i.e. flu season, preventative medicine, and wellness initiatives. So those are valuable reminders. And then, we have some education-based communication on some strategies to help lower your costs on healthcare. So many of you have already received a membership card. I know the folks at the CLI meetings received some information as well, and folks that are already starting to receive their cards that we've mailed out to you. You do need to activate those cards and enroll, and just providing some additional information. So to activate your card and redeem the $20 credit, there's a couple ways to make that happen. You can go to our website, singlecare.com/activate, and type in your member number and your group number. Or if you'd like to talk to someone in person, you can call the 800 number and they can answer any questions that you might have on the program, and ultimately activate your membership. As I mentioned before, all your household members are eligible for the ALA SingleCare membership. I did have a couple of questions on, hey, my son or my daughter is away at school or outside of the household. Not a problem. As long as they're somehow connected to you, we'd love to have them as a new member. And obviously, they need to be 18, and they receive the $20 credit. So quickly, Alan mentioned that this product and this free benefit is available for you to take back to your member firms. So why offer it to your member firm employees? A valuable health benefit for every employee. So we have a lot of folks that are full-time, and then we have a lot of folks that might be part-time, 1099, seasonal type of employees that aren't eligible for benefits. You're able to enroll them in SingleCare and offer a nice benefit to them for free with no obligation if they're not currently eligible for any of your other benefits. It's a great tool to increase retention, lower employee out-of-pocket costs. If you are on some of the plans that are self-funded or partially self-funded, you can redirect claims and obviously improve some productivity. Super value, obviously, you don't pay for anything until you go to use it. Super simple, and again, you can offer it as a benefit to employees and their families. What's in it for you? Savings, convenience, price transparency, and simplicity. Again, kind of the four cornerstones of what constitutes a SingleCare membership. How do you enroll your firm? The best way to do that is to contact Alan Wilson, and he can provide you with all the information, enrollment package emails, etc. This includes an email link for firm employees. We have some templates available. We also have a one-sheet information for PDF for the employees. We make it really simple for you to communicate this benefit to your employees within the firm. But the best place to start is to have a quick conversation or email Alan, and he has all of the information to get that set up for you. We have a couple frequently asked questions. We do this, all the time with different groups and whatnot. So some things definitely come up. So does a SingleCare membership cost anything? SingleCare memberships are free to ALA members, member firm employees, and their families. You only pay for the products and services that you use. Can I use SingleCare on vacation or in other states? Absolutely. If a product is available in any state, you're able to use it. I live in Arizona, as you can imagine. We have a lot of seasonal residents all around, and certainly they're able to utilize the product if it's available in their area. Can you offer SingleCare to your firm? Absolutely. Alan at GLJ Benefit Consultants can assist in you in enrolling your employees and their families. How do I make sure I get the ALA member to $20 credit on dental or medical visits? It's super important that ALA members receive their credit when they enroll via the custom landing page we've created for ALA members to activate their card, or when they visit their dashboard and enter the ALA 20 in the credit field. Again, contact Alan and you will receive your link. Does this replace my insurance? No, SingleCare is not insurance. It doesn't get you out of any penalties, both on a business or personal level, this is available to help supplement and lower costs and be a good shopping tool, but it certainly does not replace your insurance. Then the last one that we typically see is how does this work with insurance? So we offer access to pre-negotiated rates on many products and services. This doesn't necessarily coordinate with your insurance, although if you do use our products and services, we provide you with all the documentation and the price that you've paid. If you do have an out-of-network deductible, you're able to submit those to your carrier, and that's between you and them. So I know we have a few questions here that have come up, and maybe I'll try and answer a few of those, Alan, if you think we have time to do so.
Yeah, go ahead and answer a couple of them, and then we'll wrap up. We want to make sure that we wrap up by 11:45.
Perfect. So is it similar to discount pricing services by dentalplans.com? I'm not familiar with those folks. I'm not quite sure if that's a monthly membership or not. We do offer extremely competitive pricing across all of our products and services. Benefits of our product certainly is the ability to, I think we have a line there. Uh-oh.
Can you go ahead?
Good
Can you go ahead
afternoon,
and
Archer.
mute?
The conference has been muted.
Okay, we'll start back again. I think we got everyone muted here. But we do offer all of those products and services at discounted rates. Will SingleCare participating doctors accept both SingleCare along with regular insurance? It's kind of an either and or. In many cases, we do offer, alongside, but again, it's kind of either or. You use your insurance or you're able to use SingleCare. How does it compare with contracted rates? How do we coordinate to save you money? Again, we offer a discounted fee schedule and the ability to see the price up front. So I would definitely encourage you to look at any insurance plans that you have and coordinate with looking at those prices versus the prices that we offer. What are the talking points to employees on group plans? Alan would be a great resource to visit with on your particular plan that you might be offering and how they can use SingleCare within your firm to coordinate. I can tell you right now, everybody on this call and everyone in this country can benefit from just shopping smart for prescription drugs. That is the lowest hanging fruit to save yourself some money. It works with any plan, whether you're on it or not, whether it's an HSA or a co-plan with a deductible. Last one here, will there be dental and medical rollout nationwide in Q2 or state by state? Both the national dental and vision will be a national rollout. The medical will be state by state. Whether you are in those particular states, we will be emailing you when products and services are available. Will this benefit extend to employers who become terminated? Would it conflict or be an alternative to COBRA? Once you're a SingleCare member, you're always a SingleCare member. You do not have to coordinate anything as far as termination. It has nothing to do with COBRA or insurance. It's a free benefit. So you as a administrator don't have to do anything as far as the product. And then the last one here, can we get a copy of the slides, please? We're actually going to post this, I believe, somehow on the ALA web experience. So there'll be a copy of this webinar. It's in entirety with all the slides and the audio as well. So last slide here is Mr. Wilson's contact information. So Alan there at GLJ Benefits, his email address and 800 number. He is available at any time to answer questions for you as a member, or if you'd like to get some information on taking this back to your firm.
The conference has been unmuted.
Great.
Alan, I've just
David,
unmuted the conference, so yeah, there you go.
Great, David. Thank you very much. Thank you all for joining today. Remember that all members are going to be receiving their own cards here, and some have already received some cards. You may have already received your card, but every member will be receiving their cards beginning very soon. Within a week to 10 days, you'll get your own card. If you have questions, email me or call me at this number, and we'll be happy to answer the questions that you have. Thank you again for joining us today, and we'll look forward to hearing from you, and you'll hear more about this program as it continues to grow. Thanks, and have a great day.